Sports injuries are injuries which occur in competitive and recreational sport. They involve predominantly two kinds of injury. You can either have an acute injury when you have a high amount of force occurring at a particular moment, either injuring the ligament or breaking the bone. At the same time, there is a group of injuries which is called the overuse injuries. Overuse injuries occur over time. That means if you play a sport very frequently and in an inappropriate level for your conditioning level, then you will get an overuse injury. So these are what we categorize as sports injuries. Interestingly, you can divide sports into two main groups. One are the contact sports and the non-contact sports. Both kind of sporting events can cause injury, but we know for a fact that contact sports cause more injuries, and the injuries are usually severe. What I mean by contact sports is football, futsal, hockey, even racket sports such as squash, where there is close proximity between the players and they are not separated, can cause injury at a higher degree. Preventing injury, particularly in futsal, there are two areas that you can look at. One is ensuring that when you play, you are wearing the appropriate equipment. That means you wear your futsal shoes, you are appropriately attired, because when you wear proper attire which is breathable and you wear shoes which are appropriate for futsal, and particularly the synthetic surface that you play on, it minimizes injury. But there is another facet that you need to look at. If you play immediately upon alighting from your car, then it's not going to be a good thing. You need to warm up, you need to stretch, and after playing your game, you actually need to warm down, and this actually also prevents injury. So there is the element of what you use while playing, and there is also the element of what you do before and after the game that prevents injury. If you keep to this, I think you will be safe. A lot of people understand that warming up is very, very important. Okay, when you warm up, you increase the temperature in your muscles gradually, all right? And therefore the muscle becomes more flexible. After that, when you do your stretches, you prime the muscle for activity. So when you are playing your game, you are already having a muscle temperature which is optimum for activity and the futsal game. Warming down is also very important. After you stop playing, a lot of the blood will be pulled up in the muscle. If you warm down by simple series of just walking around the court after the game, the extra blood can be transferred out of the muscle, and the muscle can go back to its normal state. And therefore, at the end of the game or the next day, you will be less sore. So you keep yourself away from injury. Just at the side of the court, if you have access to an ice pack or just raw ice put in a plastic bag, applying ice on the injured part will help you reduce the swelling and pain. Okay, the simple way is that you fill up ice in a plastic bag, wrap it around with a towel, and put it over the swollen part for about 20 minutes. And this is to be repeated every 2 hours for the first 24 hours. That's ideal, and that really, really helps. Now, if you are uncomfortable at the joint, you can't move the part fully, or you have problems putting weight on the ankle or the knee, you need to see the doctor. It is not safe then to just put ice and leave it be. Now, the full protocol requires 4 things. One is you should rest the part, okay? And they say that if you elevate the part probably on a pillow when you sit down, it also helps reduces pain and also swelling. The third part is the ice that I told you about. And compression bandages do help the swelling, not so much the pain. The problem being that if you apply it too tight, you might have more pain. So the safe way is that if you notice that you can move the part well, okay, putting a bit of weight on it does not cause a lot of pain, and you can walk 3 or 4 steps without help from someone else, then taking a simple pain relieving medication like paracetamol or any simple non-steroidal off-the-shelf medication and ice should help you. But if you're still uncomfortable the day after the game, go see your doctor. The ideal recovery period depends on the severity of injury. Minor injuries, minor sprains, where there is only a partial injury of the ligament or joint, usually heal in 2 weeks. Worse injuries take about 4 to 6 weeks to heal. However, I normally advise my patients that even after they heal completely, they wait another 6 weeks before they play. So in all, it usually takes 3 months before you're allowed to go back to sports. That's just a general statement. Do play futsal, it's a fun game. But also understand that it is a game which demands a lot from your body. You need to understand your body and you need to play at a level which is appropriate. If someone like me, 40-year-old, decides to play with a 16-year-old group of futsal players and I try to keep up with them, I will possibly get injured. So what I'm trying to say is that you always play up to your level, and it is important to listen to your body. If during the game you feel pain in a part of your body, whether it's the knee or the ankle or the lower back, you need to stop, because that's your body saying that it can't take the game. Don't play through pain. Do enjoy yourself.